Now for the next bone issue, which we are going to discuss, this is what is now the hereditary multiple exostosis. Okay, so when you are breaking down the word like this, of course you know that anything hereditary, you inherited it from your patient, from your parents. Okay, when you say something is multiple, a lot of places are affected. 1, 2, okay, 3, 4, 5, right? So you have bone growth on plenty sides, you know. So hereditary multiple exostosis is also known as what? Diaphyseal aclasis, because most of the growths, they happen around the diaphyses, you know, and all of that, you know. Or multiple osteochondromas. Okay, so it's a rare genetic disorder. This one you have what? Benign bone growths, that's exostosis, but they are multiple. Okay, they are not, you know, mono. Okay, and they usually occur in the long bones in childhood. Okay, so it's an autosomal dominant inheritance. Okay, so autosomal dominant meaning if one of your parents have this issue, there's a risk of you having the issue, right? So there's mutations in some genes known as what? The EXT genes. Okay, so you can have mutations in the 1 or in the 2. So it typically appears in childhood or in children that are aged 3 to 4, and usually becomes noticeable, okay, during growth. So you have it occurring, that's worldwide, right? In 50,000 people, you see it in one person. Okay. So lesions, exostosis, that's the osteochondromas, they're actually benign cartilage-capped bony growths. Okay, they can be sessile flat, or they can have a peduncle. Okay, so they are benign, means that they will not really spread to other places. Okay, but you can see they cause a lot of issues. So bones that are mainly affected, we have bones like the femur, the tibia, the humerus, the forearm bones, sometimes flat bones like the pelvis and also scapula. Okay. So symptoms is you can see visible lumps, okay, visible lumps which can cause cosmetic issues, you know, bone deformities, bowing of the limbs, short stature, angular deformities, pain or discomfort, restricted movement. You know, if it interferes with joint, the way you get to use that joint will not be like, you know, a good joint. You understand? So there's also risks of it becoming cancer though, but just 1 to 5% of cases. Okay, so you diagnose it from just, you know, physically you see that what a patient has a deformity, then but many things could cause deformities. Do you understand? So you might actually want to do imagings like x-rays. They can do genetic testing to now specifically know the gene that has the issue, which you get to see that what the EXT1 or the EXT2 genes will have the issues. Now you treat it, sometimes you can just observe, okay, and monitor over time. Sometimes if it is causing too much pain or deformity, you have to surgically remove the bone growths. Okay, then orthopedic management like corrective surgeries for deformities. Then they should keep monitoring that patient because they have a risk of that issue becoming a cancer.